Hi everyone, I'm Timothy and I'll be presenting the final part, which is part 6 on conclusion future work. So just a recap on the story so far. So we have identified that UPDRS, which is Unified Parkinson's Disease Rating Scale, is used to assess the severity of Parkinson's disease in an individual. However, this test is expensive and inconvenient for both medical professionals and the patient because it has to be done in person. Meanwhile, the development in wearable sensors and machine learning techniques allow for sophisticated analysis of speech signals. So wearable sensors is to be able to identify and to save these signals, whereas machine learning is to be able to process these signals. So the problem statement that we have here is, can telemonitoring be used to assess the severity of Parkinson's disease as effectively as UPDRS? So that's the question we look at in this paper that we did. And so the simple conclusion is yes, and using a SVM model results in a 99.4% accuracy in diagnosing Parkinson's disease severity level, as would you somebody who uses a UPDRS. A bit on future work. So the UPDRS actually has 4 sections. So if you can look here, there is part 1 looking at intellectual functions, and then you have mood, you have behavior. There's also part 2, part 3, and part 4. So the future work that we're thinking here actually is because of speech signals, which is the data that we used in our paper, is only a subset of all parts combined. So it is only able to identify voice and speech signals. So if we really want to use machine learning or to do away with UPDRS, we would need a lot more sophisticated telemonitoring sensors that is able to proxy for other human sensors. So for example, in part 2 on activities of daily living, so the doctor would need to assess the ability to be able to brush teeth. This has not been really, there is no substitute for this in terms of telemonitoring sensors. And then in part 1, there are diagnosis of apathy, for example. This is also not able to be picked up by telemonitoring sensors. So in terms of future work, there needs to be a lot more thought and development in developing more sophisticated telemonitoring sensors. With that, thank you from our group.